What we wanted to talk a little bit about was a little bit more about this whole issue of knowing and getting and making the right kind of referrals to resources to clients, which I know isn't always easy. When you first were hired as a community health worker at Transitions, I think maybe Emily gave you sort of an outdated kind of binder of resources in the city for folks coming back to community from prison.
Yeah.
And tell me a little bit about what it was like to start your job with an outdated binder of resources.
At first I looked at it, I kind of like laughed, and because Emily was like, I want you to hand this out, because I had just started, and I probably hadn't been there even a good month. So she gave me the book, and she's like, oh, I want you to give this out to all the clients. So I look at the book, and I'm going through this book, and I'm like, half these programs don't exist, and I'm thinking to myself, you were giving clients this? It just wasn't a good fit for our clients.
Yeah.
So it would just basically frustrate them even more.
Yes.
So
it's worse to give a bad referral than no referral at all.
Yeah. Something a bad referral is worse than you just might well just say, forget it. I'll work on something. But if you're gonna give them a bad referral, that might just set them back even more, because then they're already frustrated. So when you give them a referral to a place that might not even exist, the staff is not that helpful, that's gonna set them back some even more.
Yeah.
It's gonna really upset them.
Yeah.
And I don't blame them.
Or they spend all their time, they take 2 buses across town, they show up and it's closed, or they show up and they don't meet the eligibility guidelines, so they're not eligible.
Yeah.
And I think these were sort of early days around resources specific to reentry. But what did you do with that binder? Did you throw it out, or did you just sort of start crossing out the ones that didn't exist? How did you start to create a viable list of resources for your clients?
Well, basically, I looked at it, and I said, well, some of these are still around, and some of them aren't. So I kind of like X'd out the ones that wasn't around, and I kind of like wanted to, and the ones that was still on there, I kind of like went to them, introduced myself. I wanted to check out the program. I introduced myself, what my program was about, who I help. Specifically, this is who I help.
Yeah.
And if they didn't fit the, requirements of who I was working with, I kind of just X them off the list too.
Yep.
I kind of had a system, I put the stars on it. Worked out perfect, because every place that I went to, they also needed the same needs too. They needed a place where they could send their clients that had medical needs.
Yes.
So, we worked hand in hand that way. I got on the bus, and I would just go from place to place, neighborhood to neighborhood.
You really created your own guide.
Yeah.
Because one didn't exist when you started.
Yeah.
And I always think that those personal relationships, not just knowing the name of a good agency that has a program or a service that my client might benefit from, but knowing somebody who works there that's maybe going to take my call. Have those personal relationships paid off for you and your clients?
Oh yeah, definitely. Because now we're like hooked up to every program that deals with reentry, and we can make a phone call, and they were like, if they can do it, they'll do it, And if they can't, they say they'll give us a timeline when they can do it. But if the client needs something right then, we're on to another one.
Sometimes a referral is giving a client a safe place to go. Sometimes it's going there with them.
Yeah.
And sometimes it sounds like it's bringing the services to them, like bringing food to where they're staying.
Yeah. Well, to me, a good referral is a place that you would go yourself.
Yes.
Yeah.
That's the standard.
Yeah. If you wouldn't go there, why would you send your client there?
Yeah.
So
your clients are probably good sources too.
Yeah.
They come back and say, that was a thank you. That was a good place to send me, or I wouldn't send anybody else there. Or,
yeah. I've learned some of the best resources is from our clients. Our clients come in and tell me some things about some housing opportunities, that they just happen to stumble upon. He's like, oh, these would be perfect, Ron. You know, they'll bring me the flyer and everything, you know. And they'll tell me, hey, you need to send them over here.